September 6th started out like any other normal workday. My alarm went off at 5:15. I grabbed a quick shower, got dressed, and fed the dogs. My wife prepared a breakfast, and we sat down for a few minutes to talk about the day. She reminded me that she had a 9 o'clock appointment with her OB and asked if I had planned on going with her. After some discussion, we decided that it was going to be a normal visit and I wouldn't go. As with every morning, she told me to drive safe as I left the house for work. I got to work at 7, got caught up on a few emails from the night before, and then met with my group to go over the activities for the day. The daily ops conference call was at 8, and I had to leave early because of a scheduled meeting with the OHF. I got back to my office around 9:30. My wife called to tell me that our appointment went well. The baby was now 38 weeks, which is considered full term, and we could expect his arrival any day. She let me know that she was going to stop by the house before going to work. All of a sudden I hear a strange noise, sounding like a fax machine coming from the other end of the phone. We hadn't ended our conversation, and it wasn't like her just to hang up. I tried calling her back, but the phone went straight to voicemail. I tried several more times, but I couldn't get her. So I tried calling the house, thinking that maybe she had made it home, but no one answered. Deep inside, I knew something was wrong, but I was helpless. I sat at my desk, stunned, not knowing what to do. A couple minutes later, my worst nightmare came true. A stranger called to tell me that she was at the accident scene with my wife. My wife was conscious and able to tell her my phone number. She let me know that it wasn't serious and that she would stay with her until the paramedics arrived. I immediately left my office and headed for the hospital. It took me about 30 minutes to get there. The ambulance arrived a few minutes later. After some time of being evaluated in the ER, the baby began to show signs of distress, and an emergency C-section was deemed necessary. We were instantly rolled from the ER room to the elevator and on our way to labor and delivery. Inside the elevator, I remember being bombarded with questions of consent. Do you give us the okay to do this? Do you give us the okay to do that? Once we exited the elevator, my wife was wheeled to the OR, and I was shoved in a room. Nurses and doctors were running back and forth. The urgency of the situation was obvious. Our son was born just minutes later, but not breathing. The hospital staff worked quickly and thankfully were able to resuscitate him. He was taken directly to the NICU, or the neonatal intensive care unit, and attended to by a new set of doctors and nurses. Within an hour or so, I was allowed to see him for the first time. He had more tubes and wires connected to him than I have had in a lifetime. The nurses asked me his name, and I remember saying that we had narrowed it down, but not yet picked the final. We wanted to wait until he was born and then decide from our short list. His temporary name became Baby Boy Hill. The staff soon realized that his condition was serious and made the decision to transfer him immediately to a more specialized hospital. 2 highly skilled nurses from Winnie Palmer Hospital arrived by ambulance and prepared him for the ride to Orlando that afternoon. But before they left, my wife, still recovering from the accident and surgery, was able to see our son for the first time, even though she doesn't remember to this day. I was then faced with another hard decision. Should I stay at the hospital with my wife or travel to Orlando to be with our newborn son? I ultimately decided to stay with my wife at the hospital that night. The next morning I headed to Orlando. Our son had been sent to the highest level NICU of the hospital. He was placed in a room with 3 other struggling babies. 2 neonatal nurses and a respiratory specialist were assigned to oversee his care and were in the room at all times. A neonatal doctor assigned to the unit was also just a few steps away. I immediately met with his new caregivers and was advised of his condition, treatment, and prognosis. With the help of close resources, my wife was able to be transported from the Rockledge Hospital to Winnie Palmer that afternoon. She was placed in a different wing of the hospital, and soon after her arrival was able to Skype into the NICU. The next morning, which was Saturday, the nurses cleared a path for my wife's hospital bed to be rolled into the NICU. She amazed us all when she showed up in a wheelchair. The hospital quickly became our home away from home. I stayed in the NICU from 5 o'clock each morning until late in the evenings. The hospital staff was sympathetic to our situation and allowed us to break visitation rules. I was able to escort numerous family members and friends into the room to meet and visit with our son. On Monday morning, when I arrived at the NICU, the nurses let me know that we would be able to hold our son for the first time. My wife couldn't get down there fast enough. Unfortunately, the excitement quickly turned to desperation. The doctors informed us they had done all they could do, and recovery wasn't expected. A recliner chair was moved into the NICU. The nurses adjusted the numerous tubes and wires, and for the next hour or so, my wife became a mother. As she held our son until the physical pain from her injuries and surgery was too overwhelming. But before he could be placed back into his bed, I asked if I could hold him. He passed away in my arms minutes later. Once we got home, the pain from this unbelievable ordeal didn't stop. 2 days later, we met with the funeral director to discuss details for a service. Saying goodbye to a loved one and planning a funeral service is hard, but when that loved one is a child, it makes it all that much harder. A good friend of ours volunteered to plan and lead the service. From the beginning, my wife said that she wanted the service to be a positive impact for all attending, and it was. After the service, my wife commented that the Space Center must have shut down because of all those that attended. My wife is completely healed from all of her injuries. The only scar to remind her of the accident is unfortunately due to the C-section. On a personal note, I would like to thank all of you who sent cards and emails and contributed with financial donations, my team for stepping up, and HR and my senior management for their understanding and sympathy. My son died as a direct result of someone's poor decision behind the wheel of a car. And I'm mad. My name is Todd Hill. I'm the ISC Safety and Health Programs Manager for this contract. For the last 20 years, I've done all I can do to protect you. But on September 6, 2012, I could do nothing to protect my wife. Her car came to a complete stop at the intersection of US 1 and Barnes Boulevard. She was going northbound on US 1 and stopped behind two other cars in the left lane. Many, if not all of you, have probably been through that intersection. A car going in excess of the posted speed limit, 70 miles an hour in a 55 mile per hour zone, slammed right into the back of her. She did not know it was coming. Here's a photo of our car before the accident. Here's what it looked like afterwards. Because of her condition and amount of damage to the car had to be cut apart to extract her. The paramedics at the scene commented that she shouldn't be alive. My life has changed in many ways because of the accident and loss of our son, in ways I probably haven't yet recognized. The reason for telling my story today is to make you think about the way you drive, and to make sure you're prepared if a similar tragedy were to happen to you. I've given you 10 things to think about for the next 20 minutes. One is, I want you to reduce the number of driving distractions. 2, think about wearing a seatbelt if you don't already. Choose not to drink and drive. Accept the personal pledge to drive safe. Encourage others to drive safe. Review your auto and homeowners insurance policies. Review your company health and insurance benefits. Develop a support system if you don't already have one. Donate to a charity and prepare a plan for the unexpected. Let's talk about distracted driving for a minute. Distracted driving is any activity that could divert a person's attention away from the primary task of driving. Some things that could distract you while driving include texting, using a cell phone or smartphone, eating and drinking, talking to passengers, grooming, reading including maps, using a nav system, watching a video, or adjusting a radio, CD player, or MP3 player. There are three main types of distraction. There's manual, where you take your hands off the wheel. There's visual, where you take your eyes off the road. And there's cognitive, where you take your mind away from driving. Text messaging, of all the distractions, is the most serious because it distracts you from doing all these things. A few statistics for you. In 2010, more than 3,000 people were killed and 416,000 people were injured in crashes involving a distracted driver. 18% of injury crashes in 2010 were reported to be caused by distracted, affected crashes. In the month of 2011, in June, more than 196 billion text messages were sent. Now, those aren't text messages sent while people were driving. Those are text messages just in general. 11% of all drivers under the age of 20 involved in fatal crashes were reported as distracted at the time of the crash. And 40% of all American teens say they have been in a car when the driver used a cell phone that put people in danger. Drivers who use handheld devices are 4 times more likely to get into crashes, and text messaging creates a crash risk 23 times more worse than driving while not distracted. Sending or receiving a text while driving takes the driver's eyes off the road for about 4.6 seconds, which is the equivalent of an entire football field at 55 miles per hour. Let's talk about seatbelts for a minute. Why is it important to wear a seatbelt? Seatbelts protect you from being thrown from the vehicle. If you are thrown from a vehicle, your risk of death is 5 times greater. By securing you in your seat, a seatbelt protects you from being thrown into other parts of the car and outside of the vehicle. It also helps you stay in your seat so that you can be in control of your vehicle. Seatbelt laws apply to all cars, pickups, trucks, and vans operating on Florida roads. All passengers in the front seat must wear a seatbelt. All passengers under 18 must also wear a seatbelt. Doesn't matter where they are in the car. Children 3 and younger must be secured in a federally approved child restraint seat. Children 4 through 5 must be secured by either a federal approved child restraint seat or a seatbelt. The cost for a violation is $30, and if it's a child, it gets increased to $60. Seatbelts are the single most effective traffic safety device for preventing death and injury. Wearing a seatbelt can reduce the risk of crash by 50%. Between 2004 and 2008, it's estimated that 75,000 lives were saved. 42% of passenger vehicle occupants killed in 2007 were not belted. And a study that was done in 2009 estimates that more than 1,600 lives could be saved, 22,000 injuries prevented, if 90% of the people in all of our states would buckle up. Another study in 2007 says that seatbelt use remains the lowest among young drivers. It was higher among females than males, and it was lower among drivers who drove alone than drivers with passengers. So passengers, it does make a difference to the driver when you're there and you comment that a seatbelt needs to be worn. Choose not to drink and drive. Although the number of drinking driving accidents has decreased significantly over the past 20 years, innocent victims continue to be affected by a driver's poor decisions. Mixing alcohol and driving just doesn't go together. In 2010, more than 10,000 people were killed and 350,000 people were injured. Every 53 minutes on average, somebody is killed in a drunk driving crash. You can see there in the stats that the increases from 2011, from 2010, the number continues to keep going up. In the state of Florida, 30% of traffic-related fatalities were due to drunk driving, about 716 people. And every year, about $132 billion is spent on drunk driving and the costs of driving under the influence. The average drunk driver has driven drunk 80 times before their first arrest. On any given day, your family shares the roadways with more than 2 million drunk drivers who have had 3 or more prior convictions. Why do we bring this up during the holidays? It's because this is the time of year when most people decide that it's okay to drink and drive. 52% of fatal collisions occur on Christmas and 57% on New Year's Eve, New Year's Day. This next slide talks a little bit about what blood alcohol content is. I'm not going to go through all the details. Just know that it doesn't matter how much you drink. As soon as you take that first drink, you are impaired. Okay? You can see the details there and some of the things that happens to you as soon as you start taking a drink.